Dear students, today we are going to learn your social and political life chapter number 2, and the name of the chapter is Role of the Government in Health. Students, what we're going to learn in this chapter is what is the role of the government in healthcare. That means what type of role that government play in healthcare. ꯍꯥꯏꯕꯗꯤ ꯉꯁꯥꯏꯒꯤ healthcare ꯁꯤꯗꯩꯁꯤꯗ governmentꯅ ꯁꯥꯟꯅꯔꯤꯕ governmentꯅ ꯂꯧꯔꯤꯕ ꯔꯣꯜꯁꯤꯡꯗꯣ ꯀꯔꯤ ꯀꯔꯤꯅꯣ ꯍꯥꯏꯕꯅꯆꯤꯡꯕ ꯃꯌꯥꯝꯗꯨꯅꯤ ꯃꯁꯤꯒꯤ ꯆꯦꯞꯇꯔꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯍꯧꯖꯤꯛ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯗꯣꯏꯁꯦ. Student, in a democracy, people expect the government to work for their welfare. Democracy chatpa leibak amadadi ngasaygi prajajingshina government jingshina praja mayamsiki safanaba adugumba thabak tawrakani haidana people mayamjingshina expect tawiko. Maramdi people na adumaina expect tawribasigi maramdi government leiriba democracy dadi leiriba government mayamjingse people na elect tawraga. That means people na elect tawba adugumba representatives mayamjingduna semba adugumba makhalgi government ama oibanina people mayamjingsina haibada tabirakani amadi people mayamjingsigi damakta safanaba adugumba welfare oiba thabak tawrakani haidana people mayamjingsina government gi side tagi expect tawiko. Aduga ngasaigi people jingsina expect tawriba adugumba jingse kari karida mayamgi welfare oinanaba tawrakadage haiba matamda education, health, employment, housing or the development of the roads, electricity, etc. sigumba leiriba mayam jingsida praja mayam jingsigi welfare oinanaba thabak tawrakani haidana saigi democracy chatpa adugumba country da leiba people mayam jingsina government gi side tagi expect tawiko. Now student, in this chapter what we're going to learn is what are the meanings of health and what are the problems related to health. That means in this chapter where focus is specific on the healthcare systems. Haibadi masigi chapter sida aikoina focus tawdurise anamana health ta focus tawgani habani ko. Aduna masigi chapter sida aikoina discussion tawdurise mainly the meanings of health and the problems related to healthcare systems. Aduna sigumba ngasai healthcare gi maramda healthcare sida kari problem laiba aduguma mayamduni hojik masigi chapter sida aikoina discussion tawrakaduise. Now come to your next page, and this is your first topic. What is health? Health means our ability to remain free of illness and injuries. Health haibadi any illness amadi injuries yaudana tinjang kaijang daba adugumba gi ability duni health haidan harise. That means health haibadi saigi illness amadi injury siguma mayam jingsidagi free oina leiba ngambagi adugumbagi ability duni health haidana haisi. But health isn't only about disease. Aduna health haiba matamda aikoina disease adugumba lainatina disease mayam jing sigi jingsi kaktangda aikoina health ka related oigani haidana khanbadudi aikoina lali haibani ko. That means health haibase palakpa matamda aikoina disease haidana hekta aikoigi mind lakpado adudu yade habani ko. That means disease si kaktangna health ka related oide disease nataba atopa adugumba factors kaya marum amasu health ta effect tawba factors mayam amasu lay haibaduni sida harisi. And apart from disease we need to think of other factors that affect our health. Aduna hojikta so koin haikre disease kaktangna health ka related oiba nate disease nataba atopa factors kaya marum amasu lay haidana haigre. Aduna disease nataba atopa factors kaya marum amasu akoigi health ta effect toba mayam amalay. For example, if people get clean drinking water or a pollution free environment, they are likely to be healthy. Aduna kanagumba miyoy karana clean drinking water fangaba aduga amuk pollution free environment fangaba adugumba miyojingdubudi makoidi they are likely to be healthy, makoidi healthy oina masamo fana laigani habani. And on the other hand, if people do not get adequate food to eat or have to live in cramped conditions, they will be prone to illness. Aduga kanaguma miyoi karana chanaba thaknaba fazana fangdaba aduga yamna amotpa jaga adugumbada lairakpa matamdadi they will be prone to illness, makoidi anaba na pik thangani habani ko. Haibadi ngasagi lairiba ising aruba thakpa fangba adudagidi pollution free environment sigumbagi jagada leiba miyojingdudi makoidi healthy oigani aduga chaba thakpa fazana fangdaba adudagidi amotpa jaga sidai leiba miyojingdudi healthy oiroi habaneba. Aduna sigi matek sida koina kari khangba ngamge haba matamda healthy ama oiba haiba matam sida disease tagi free khaktang oiraga aikoina healthy oini haibado lali habani ko. That means ngasagi lairiba aikoina thaknaba ising adudagidi aikoina lairiba environment adudagidi ngasagi adequate food sigumba lairiba factors mayamjingsisu health ka related oi habani apart from disease. And all of us would like to be active and in good spirits in whatever we may be doing. Aduna mibong khudimang na pamise any activities akoina tawba matamda yam active oiba amadi good spirits amaga loina na tawba haibase mayam loina mang pamami ko. It isn't healthy to be dull, inactive, anxious or scared for long stretches of work. Aduna karigumba aikoina hangchang se yamna tallaba inactive oiriba anxious oiraba aduga yam sangna thabak tawrakani haibagi aikoida akiba fauriba aduguma miyojingdudi makoi haksangdo healthy oidrabaneba. So we all need to be without mental strains. Aduna saigi healthy oiba haibasida sida akoina kari mathau tage haiba matamda akoi hakchang si yam active oiba good spirits oiba adudagidi mental strains siguma mayam jingsidagi free oina leiba haibase masisu health related oi habadi ko. Aduna akoi hakchang si yamna tallaba inactive anxious adudagidi matam yam sangna thabak tawba ngamdaba siguma miyoi jingsidi makoi gi hakchang do healthy oidrabani aduga yam active oiba good spirits oiba adudagidi mental strain leitaba sigumba mayam jingsisu healthy oiba adugumbagi symptoms amani. That means healthy person amani habani ko. Aduga dull, inactive, anxious sigumba oirakpasina unhealthy oiraba adugumba miyoi amagi example ni habani sigi matek sida hairisi. So all of these various aspects of our life are a part of health. Aduna aikoigi miyoiba amagi life ta lairiba adugumba health ki part amaneba sigi ngasai lairiba active good spirits adudagidi free from mental strains sigumba mayam jingse adudagidi ngasai lairiba dull inactive anxious adudagidi scared for long stretch of time aduna sigumba mayam jingsena unhealthy gi symptoms. That means unhealthy oirabagi example aduga healthy oiba miyoi jingsena active good spirits adudagidi mental strain leitaba aduna sigumba mayam jing lairiba jingsina ngasai healthy oiraba adugumba person jingi example niko. Aduna ngasai lairiba miyoiba jingsigi makoigi life ta lairiba adugumba health ki part amaneba. Aduna ngasai mamangda akoina haigriba disease si khaktanga health ka related leiba nate disease nataba atopa factors mayam amazu lairiba koigi peoples mayam jingsidi lairiba peoples mayam jingsiga lairiba peoples mayam jingsigi health ka related leise disease khaktang nataba atopa factors mayam amasu lei habani ko. That means disease khaktang dagi free oiraga healthy oigani haibado lali haibadoni sigi matek sida hairise. Aduna disease nataba atopa lairiba factors mayam jingsisu fully develop oiba ma changi. That means atopa lairiba factors mayam jingsidagisu free oiba ama changi habani apart from disease. Aduna ngasai disease khaktang dagi free oiba khaktang natana lairiba atopa factors mayam jingsidagisu free oiraba matamdada healthy amadi ngasai health sidai sida yamna afaba yamna develop health sectors amadi healthy persons ama oi haibado adumaina haigadabani haibani disease dagi khaktang free oiraga healthy oi haibadudi lali haibani sigi matek sidai sida haris. So student, I hope you all understood what is health. Then come to your next page. Healthcare in India. Now let us examine some of the aspects of healthcare in India. India da leiriba adugumba healthcare gi aspect khara ko. That means healthcare India da leiriba adugumba health system. That means healthcare systems India da leiriba adugumba ngasai gi healthcare se. Masigi maramda koina aspect khara hojik ko examine tawrasi ko. Aduna sidai sida koina table lama oi compare and contrast the situation expressed in the first and second columns. Saigi lairiba sigi column ani lay masigi column sidai sida yaurise compare amadi contrast ni ko. Aduna ihan hanba column sidai sida koin urisi kaino. India has the largest number of medical colleges in the world and is among the largest producers of doctors. Prithibida koigi India se largest number of medical college khwaidigi leiba adugumba country amani aduga amuk doctor jingsu doctor produce tawbagi changda khwaidigi yamna doctor produce tawba adugumba country amani ko. Approximately more than 30,000 new doctors qualify in every year. Jahi khudingi doctor 30,000 nauna qualify tawe haba jahi khudingi ko. Masigi contrasta somda kari lake haba matamda most doctors settle in urban areas. Aduna prithivida India sina medical college khwaidigi yamna leiba amadi doctor khwaidigi yamna puthokpa adugumba country amani aduga chahi khudingi doctor 30,000 anouba chahi khudingi oina doctor 30,000 anouba doctor 30,000 chahi khudingi oina qualify tawe habani. Masigi contrasta kari leige haba matamda saigi adugumba leiriba prithibida khwaidigi yama doctor producer oiriba adugumba country se sidai sida doctor khudimak anamana urban da loinamak lei ko. People in rural areas have to travel long distance to reach a doctors. Aduna saigi leiriba doctor khudimak urban da loinamak settle tawraga lei aduna khungangdagi leiba that means khungangdagi lakpa adugumba rural area dagi lakpa miyoi jingsidi makoina doctor yaunanaba honabada they have to travel long distance, and the number of doctors with respect to the populations must less in rural areas. Aduna ngasai leiriba doctor mayam jingsiga population sida based toraga yengba matamdadi rural area dadi doctor masing yamna handai habani ko. Aduna ngasai ihan hanbagi compare amadi contrast sigi se khoni yengba matamda kari khangba ngamge haba matamda prithibida doctor puthokpa khwaidigi largest producers of doctor oiriba amadi largest number of medical college oiriba chahi khudingi doctor anouba 30,000 doctor qualify tawriba masigumba country amana sidai sida leiriba saigi khungangda leiriba adugumba praja mayam singdadi doctor yamna produce tawjaraga su khungangda leiriba adugumba praja singsidadi doctor yamna wale haba maramdi doctor anamana urban da loinamak settle tawraga lei aduna ngasai gi khungangda leiba praja mayam jingsina layengna ba lakpa matamda they have to travel a long distance. Aduna ngasai gi lam yam sangna makoina travel toba mathau tabanina ngasai gi rural area da leiba adugumba people mayam jingsina doctor manakta lakpagi changse yamna nemi aduna ngasai gi population jingsiga base tawraga yengba matamda rural area dadi doctor masing yamna handaiba. Aduna doctor anamana urban da loinamak settle tawraga leibanina khungangda leiba miyoi jingdadi doctor masing yamna handai habaduni sidai sida haise. Aduna chahi khudingi doctor yamna produce tawba country ama oiraga su urban area da loinamak settle tawraga lei rural area dadi doctor masing yamna watli habaduni sidai sida haisi. And healthcare facilities have grown substantially over the years. In 1950, there were only 2,717 government hospitals in India. Aduna India da healthcare facilities se yam thuna yamna fastly grown tawe habani ko. Aduna 1950 dadi sumna tangi 2,717 government hospitals leirameba India da. Aduga 1991 dadi 11,174 hospital da amok increase tawrakre, and 2017 dadi hojiki hariba number se 23,583 sidai sida improve tawgreba. Aduna leiriba adugumba healthcare facilities e chahi khudingi masing sum hengalai ko akhoi Indian country sidai sida but contrast kari lake haba matamda that means ngasai healthcare facility se sum hengale haba se khoina khangba ngamgre adubu healthcare facility se sum hangacharaga su that means sum hengacharaga su healthcare facility masing sum yamgacharaga su somda kari problem lake haba matamda somda contrast kari lake haba matamda about 5 lakh people die from tuberculosis every year chahi khudingi mi lakh manga mukti TB na naraga adum shinayeba and this number is almost unchanged since independence aduna ngasai gi chahi khudingi TB na naraga siba mi lakh manga mukki sigi laiba about 5 lakh people sigi masing je independence fangarba matung bauda ngasai laiba masigi masing je kasu thoidokpa change leite adum masigi chang hida adum si haibani ko sahi khudingi TB na and almost 2 million cases of malaria are reported every year and this number isn't decreasing aduna saigi lairiba 2 million cases chahi khudingi oina malaria gi case 2 million cases 2 million gi changda saigi malaria gi case chahi khudingi adum lai habani aduga masigi number sisu kaitu handaba oideba aduna sidai sida koina kari khangma ngamge haba matamda healthcare facilities ina sum chahi khudingi sum hengachar agasu saigi lairiba adugumba TB gi amadi malaria gi sigumba gi case di handaba laite habaduni ko sidai sida koina khangma ngamise and then next India gets a large numbers of medical tourists from many countries haibadi atopa foreign country mayamdagi aikoigi India da layengba mayam ama laame haibani ko medical tourists habadi and they come for treatment in some of the hospitals in India that compare with the best in the world aduna makoina India da treatment toba laibase kari maramgino haiba matamda prithibiga compare toba matamda base oiba adugumba hospital kaya marum ama lei akoigi India sida aduna adugumba hospital jingdudani makoina layengba laisi ko aduna saigi foreign tourist mayam jingnabok akoigi India sida layengba laktana prithibida lairiba adugumba hospital mayam singsiga compare toruba matamda base hospital kaya marum ama laibanina foreign tourist kaya marum ama akoigi India da layengba laini aduna foreign tourist kaya marum ama na akoigi India da layengba lakcharaga su prithibida lairiba hospital mayam jingiga compare toba matamda adugumba base oiraba hospital kaya marum ama laijaraga su somna kari problem laige haba matamda we are not able to provide clean drinking water to all hojik fauba lairiba India da lairiba praja jing sidai clean drinking water provide toba ngamdri and 21% of all communicable disease are waterborne for example diarrhea worms hepatitis etc aduna lairiba communicable disease mayam jing sidagidi 21% di waterborne disease neba koi example oina hairabada diarrhea worms hepatitis etc sigumba makalgi disease mayam jing se waterborne ngatani aduna makoi se communicable disease ngatane aduna sigumba ngasai clean drinking water jing sidi lairiba praja pomna maksida loinamak provide toba ngamdeba aduna communicable disease na bagi percentage aduki matik wange haibani ko India sidai sida aduna sidai sida koina kari khangma ngamge haiba matamda prithibida lairiba hospital mayam jingi compare toba matamda base hospital oidana foreign tourist kaya marum ama medical tourist oina atopa country dagi kaya marum ama India da layengba lakcharaga su still India da lairiba people jingjidi clean drinking water loinamak makoi phangba ngamde aduna communicable disease nabagi chang yamna wangaga lei haibani akoigi Indian countries and then India is the third largest producer of medicines in the world and is also a large exporter of medicines aduna India se kaidorba medicine produce tobada third largest producer of medicine in the world ni ko prithibi sida medicine produce tobada India se third largest ni and medicine export tobadasu India se khwaidigi chawba that means large exporter of medicines ama oiriba adugumba country amani akoigi India se adubu masigi contrast kari problem thengnage half of all children in India do not get adequate food to eat and are undernourished aduna India da lairiba angang mayamgi population sigi tangkhai amadi matik chaba chinjak adequate food to eat makoina matik chaba chinjak chananaba phangde aduna makoijingse anamana undernourished, that means malnutrition loinamang nai angang anamana. Aduna sida koina kari khangma ngamge haba matamda India si medicine produce tawbada third largest amadi medicine export tawbada khwaidagi chawba adugumba country ama oina recommend tawnaragasu India da leiriba angangsingsi tangkhai amadi matik chaba chinjak makhoi chaba phangdabana malnutrition kaya marum ama naraga lei haibaduni sigi matik sida hairisi. Aduna masigi table se aikoina nainaraba matungda masigi table se akoina study taraba matungda kari khangma ngamge haba matamda India da leiriba healthcare se nakan amaromdadi yamna develop oire nakan amaromdadi yamna systematic naina maintain tawdana atopa leiriba country mayam jingsiga compare tawba matamda adum yamna choptaba adugumba healthcare amadi oire adubu atopa side amadadi magi loopholes kaya marum amasu leiri habado akoina masigi table sida khangma ngame ko. That means ngasai healthcare gi benefit amadi healthcare da leiriba adugumba problems kaya marum ama akoina masigi table se discussion tawba matamda akoina yam line uba fange ko. Now let's continue our lesson. Kumaka satharasi all of you. In order to prevent and treat illness, we need appropriate healthcare facilities such as health centers, hospitals, laboratories for testings, ambulance service, blood banks, etc. that can provide the required care and services that patients need. Aduna leiriba adugumba illness mayam jingsidagi prevent amadi layengnabagidamakta akoina kari mathau tage haba matamda we need appropriate healthcare facilities akoina matik chaba adugumba healthcare facilities ama akoina mathau tai. Aduna karamba matik chaba healthcare facilities habadi appropriate healthcare facilities ama akoina mathau tai kari no samna hairabada akoigi health centers, hospitals, laboratories for testings, ambulance service, blood banks, etc. Sigumba kaya marum ama akoina mathau tai ba ngasai leiriba illness mayam jingsidagi akoina ngakthokpa amadi leiriba illness mayam jingsidagi akoina treatment fazana phangge hairagadi matik chaba healthcare facilities samna hairabada ngasai health centers, hospitals, laboratories for testings, ambulance service, blood banks, etc. Sigumba kaya marum ama akoina maintain tawba mathau tai ko. That means saigi leiriba adugumba patients mayam jing leiriba adugumba different types of patients mayam jing sina makoina darkar taba adugumba care and services. That means saigi leiriba patients mayam jing sina darkar taba adugumba leiriba ngasai healthcare facilities mayam ama fazana akoina provide tawba mathau tai maramdi illness mayam jingsidagi prevent amadi treatment tawnanaba adugumba ngasai appropriate oiraba healthcare facilities ngasai health centers, hospitals, laboratories for testings, ambulance service, blood banks, etc. Sigumba mayam jingse fazana maintain tawba ama mathau tai haibani ko. And in order to run such facilities, we need healthcare workers, nurses, qualified doctors, and other health professionals who can advise, diagnose, and treat illness. Aduna ngasai leiriba adugumba facilities mayam jingdu run tawnanaba aikoina kari among mathau tage haba matamda ngasai health workers, nurses, qualified doctors, and other health professionals sigumba mayam jingsimu aikoina thamba mathau tai maramdi ngasai leiriba adugumba healthcare facilities mayam jingdo run tawnanaba adugumba ngasai health workers, nurses, qualified doctors, and other healthcare professionals who can advise, diagnose, and treat illness. Sagi adugumba advice tawba ngamba, diagnose tawba ngamba, adudagidi anaba mayam ama treatment piba ngamba adugumba miyoijing kana health workers, nurses, qualified doctors, and other health professionals sigumba mayam jingsi amuk akoina mathau tai karigidamakta ngasai appropriate healthcare facilities mayam jingdubu run tawnanaba. And We also need the medicines and equipment that are necessary for treating patients. Adudagidi amuk akoina medicines amadi equipment kuzukalai. Saigi lairiba adugumba patients mayamjingdubu treatment piba matamda akoina medicines amadi equipment siguma kaya marum sichu amuk akoina mathau tai habani ko. These facilities are required to take care of us. Aduna masigumba facilities mayamjingche akoina mathau tarame habani ngasai lairiba adugumba patients amadi peoples amadi citizens mayamjingdubu take care launanabagi damakta siguma makhal makha kaya marumgi facilities se akoina mathau tarame habaduni sidai sida harisi. I hope you all understood up to this. Then come to your next page. India has large numbers of doctors, clinics and hospitals. Akoina ngasai table mamangda akoina discussion tawkraba adugumba table do akoina discuss tawba matamda table dugi ihan hanba kalam first kalam amadi second kalam ani do akoina discussion tawba matamda ngasai first kalam do akoina study tawba matungda kari khangba ngamge haba matamda India has a large numbers of doctors, clinics and hospitals. India da doctor masing yamna lay, clinic amadi hospitals India da masing yamna lay, and the country also has considerable experience and knowledge in running a public healthcare systems. Aduga mo ahoyi country je experience amadi knowledge ngasai lairiba public healthcare system se run tawnanabagi ngasai experience amadi knowledge matik chana lay akoigi country se, and this is the systems of hospitals and health centers run by the government. Aduna ngasai lairiba masigi public healthcare system se kanana run tawge haba matamda government na run tawi habaduni sigi matik sidai sida hairisi. Haibadi saigi lairiba akoigi India je karaba makhalgi country no haiba matamda public healthcare system se fazana run tawnanabagi experience amadi knowledge fazana laiba adugumba country amaneba. Aduda ngasai masigi healthcare system se kanana run tawge haiba matamda government na run tawi ko. Aduna ngasai masigi healthcare system sidai sida lairiba adugumba hospitals amadi health centers mayam jingche government na run tawgadoini, and it has the ability to look after the health of a large sections of its population scattered over hundreds of thousands of village. Aduna government na run tawba adugumba system amani. Aduna hujiki lairiba masigi public healthcare system jina kari tawba ngamge haiba matamda India da lairiba adugumba khungang mayam jingsidai sida lairiba adugumba large sections of populations mayam jingse masi sibu section na senaba ngamme habani ko sigi matek sidai sida harise. Moreover, there has been a phenomenal advancement in medical sciences whereby many new technologies and treatment procedures are available in the country. Aduna lairiba adugumba ngasai public healthcare systems saigi lairiba India da lairiba khungang jingsida lairiba adugumba populations mayam jingsibu section na senaba ngamba adugumbagi healthcare system amani. Public healthcare system aise kanana run tawbano government na run tawba adugumba system amani. Aduna masigi system jina lairiba khungang da lairiba India da lairiba adugumba khungang mayam jingsidai sida chakhairega tariba adugumba population mayam jingsibu section na senaba ngamba adugumbagi system amani. Masigi mathak sidai sida kari muk leige haba matamda phenomenal advancement in medical sciences whereby many new technologies and treatment procedures are available in the country. Aduna ngasai makal makha kayagi anauba technologies amadi treatment procedures kaya marum amasu akoigi India sidai sida phange habaduni ko sigi matek sidai sida harise. And Saigi ani suba kalam dudana kari mo haige heba matamda. However, the second column points out how poor the health situation in our country is. Saigi first column amadi hojiki sigi first paragraph se ekhon discussion tawba matamda kari khangba ngamge heba matamda India da health care se atopa countries inga compare tawba matamda yamna handhadaba adum compare tawba yaraba adugumba healthcare system ama oirame habase sigi first paragraph amadi ngasai mamangi first column do koina paba matamda khangba ngami. Adubu ngasai second column do koina paruba matamdadi kari amuk thengnage haba matamda India gi lairiba health situation se poor oi habase akoina amuk thengnai ko. Maramdi, with all the above positive developments, we are not able to provide proper healthcare facilities to people. Aduna mamangda positive developments kaya marum ama akoina mention tawkre. Aduna adugumba positive developments kaya marum ama lairagashu, still we are not able to provide proper health facilities to people. Hojik fauba lairiba praja mayamjing sida matik chaba adugumba healthcare facilities akoi provide tawba ngamdana adum lairi haibdo saigi second column do paba matamda akoi khange. This is the paradox. Aduna paradox habdi contrast habni ko. Aduna mamangda positive developments kaya marum ama leijaragasu India da lairiba adugumba mipum khudimakta matik chaba adugumba healthcare facilities idi government na provide tawba ngamde haibado akona second column paba matamda khangba ngami, masibuni paradox, masibuni contrast haidana hai. And our country has the money, knowledge and people with experience but cannot make the necessary healthcare available to all. Aduna aikoigi India hariba country sida paisa adudagidi knowledge adudagidi experience lairaba mi kaya marum ama lairami adubu necessary oiba adugumba healthcare sidi lairiba mipum khudimakta phanganbadi ngamde haibaduni sida koina haise. So student, in this chapter we will look at some of the reasons for this. Aduna makha tarakpa matamda akoina tamakkadoise kaino haiba matamda India sida money, knowledge amadi experience lairiba mi kaya marum ama lairagasu praja khudimakta necessary oiba adugumba healthcare system se phanganba ngamdribasi kari maramgi no haibado akoina sigi chapter sigi makha tarakpada adum discussion tawrokidoni ko. Aduna adugumba Masaigi reasons mayamjing dudi masigi chapter sigi makha tarakpada adum discussion taroksi haibaduni sigi matek sida haris. Students, koina makha chathadringaida Hakim Sheikh hariba masigi miyoi sigi mahaki story matek ama koi hana pasi ko. Aduna koina hojik makhada tamakadawriba adugumba topics lairiba adudagidi lairiba adugumba makhal makha kaya marumgi ngasagi reasons kaina sida harise haibadi positive developments kaya marum ama lairagasu lairiba praja khudimakta necessary oiba healthcare available ohenba ngamdribasi karigino haiba sigumba reasons adudagidi makha tarakpa topics mayam ama koina discussion tarakpa matamda sigi story je yamna kanarakani aduna masigi story je koi hana discussion tawsi. The story of Hakim Sheikh. Hakim Sheikh was a member of the Pachim Banga Khet Mazdur Samiti PBKMS and organizations of agricultural laborers in West Bengal. Aduna ngasagi West Bengal da lairiba adugumba agricultural laborers mayamgi organizations koigi Pachim Banga Khet Mazdur Samiti PBKMS hariba masigi member ni Hakim Sheikh hariba miyoise nongma evening ama 1992 da he accidentally fell off a running train and suffered head injuries. And he was in a very serious conditions and needed immediate treatment. Train dagi accident ama thoktana makokta sokpa aduga mahaksina yamna immediate treatment ama yamna serious oiba condition ama da lairakpadagidi yamna immediate treatment ama mahak mathau tarami ko. Aduna mahakse saigi Kolkata da leiba aduguma government hospital amada mahakse purami adubu saigi government employee mayamjingduna mahakse layengbiyu yaramdeba maramdi bed extra laite. That means layeng matamda ngasai adugumba patient in lainanaba adugumba bed extra laite haidana mahakse layeng biu yarakidre and atopa hospital amada amuk makoina chatluba matamda ngasai mahaki mahakna nariba adugi ngasai magi soibadugi madugi treatment taunanaba adugumba specialized doctor laite haidana atopa hospital amada su mahak amuk layeng biu yaraktre and sumai tawdana hujiki Hakim Sheikh hariba miyoisina 14 hours pung taraga marise mahangna critical state ama oina mahangna ngasagi pung tara marise mahang ngasagi matam na mange and was taken to 8 different government hospitals but none of them admitted him. Aduna sumai tawdana ngasagi Hakim Sheikh hariba miyoisina pung tara marise maha critical state amada leiba aduguma magi ngasagi leiriba magi ngasagi injury se yamna serious oiba condition ama oiraga suma pung tara mari je mahang mange arembada aduga ngasagi government hospital nipan 8 different government hospital na hujiki hariba hakim sek hariba miyoi se admitted tauba amata yarakhideba. Finally he was admitted in a private hospitals where he received treatment. Aduna kaina thangdadi mahak se private hospital do aina mahak se treatment taurami, and he spent a lot of money on his treatment. Angry and upset over the indifferent attitudes of all the hospitals that refused to admit him, Hakim Sheikh and PBKMS filed a case in the court. Aduna saigi lairiba adugumba government hospitals mayam hina mahak se layeng biu yaraktabadagidi finally mahak se private hospital amada mahak se layenge. Aduna private hospital da layeng matamna mahak paisa kaya marum mama paisa yamna mahak changammi ko. Aduna ngasaigi adugumba saigi mahaki lairiba ngasaigi Hakim Sheikh amadi ngasaigi mahaki lairiba organizations PBKMS makoi jingchina court ta case ama file torameba karigidamakta haiba matamda ngasaigi adugumba hospitals mayam jingchina mangonda utlaiba adugumba indifferent attitudes ama mangonda ngasaigi ulaktana adugumba makoi government hospitals mayam jingchida layenge mahakpu admit tauge haidana yaraktabagidamakta Hakim Sheikh amadi PBKMS ina court ta case ama file torami haibani sigi matek sida hairisi ko. Aduna sigi wari sigi makha tarakpada court na kari hairke court na kari rai tarake haibadudi koina makha sigi chapter sigi makha chatharakpada dum discussion tawrakhini ko. Aduna hojibokki oinadi akoina tangrise Hakim Sheikh hariba saigi PKBMS masigi member amo oiriba Hakim Sheikh se mangonda saigi layeng bagi mawong matau government hospital mayam jingchina yaraktaba adudagidi mahakna private hospital da changba matamda paisa mayam ama changba but mahak treatment budi tawre tawragasu paisa mayam ama changba adugumbagi case study duma akoina sigi matek sida discussion tawba fange. Now come to your next page. Koina next page dasu sida Aman amadi Ranjan kauba angang ani khakki wari ama mu akoina thengnare ko. Aduna sigi wari se kesu yamna luba wari nate aduna nakoina sana adum pajaro adubu nakoina sana adum pajaragasu ai haifet summary dumadi ai haifet palamage sigi wari sigi. Aduna sagi Aman amadi Ranjan angang ani se makoi mamanabani ko. Aduna makoi animak fever loinamak nagadoini viral fever. Aduna animak si viral fever naba matam sida Aman haibasina kara lairaba family dagi lakpani aduga Ranjan sina paisa paiba well to do family dagi lakpa angang ni. Aduna ngasaigi Ranjan sidi madi well to do family dagi lakpa angang ama oibanina mahakna layengba matamda mahakti private hospital da oina layenggadoini ko. Aduna mahakna private hospital da layengba matamda yam thuna layengba budi mahak phangi adubu unnecessary da test mayam ama tawhanba aduga unnecessary da hidak kaya marum ama thajalaktana ngasaigi paisa unnecessary da paisa kaya marum ama mangba adugumbagi condition duni sigi wari sida yawisei. Aduga amuk Aman hariba angang sidi mahakti lairaba family dagi oibanina mahakna government hospital da amuk layenggadoini. Aduna government hospital da mahakna changba matamda sat hekta layengbadi mahak phangide queue da yam sangna lepaga mahak OPD gi ticket kado kaaga mahak layenggadoini. Aduna mahakna government hospital da layengba matamda matam yamna changjaragasu government hospital da mahakna layengba matamdadi paisa yamna changde aduga hidaksu unnecessary da thajalakte. Aduna ngasaigi Aman hariba angangsina government hospital da layengba matamdadi matam changagasu paisa di yamna changde aduga Ranjan sina private hospital da layengba matamdadi matam changdragasu unnecessary da paisa amadi hidak kaya marum ama mahakna chabagi wari duni sigi wari sida yawgadoise. Aduna kaisu yamna luba wari nate aduna nakoina sana adum pajaro sigi wari sima. Now come to public and private healthcare services. Aduna hujiki Aman amadi Ranjan gi wari sina koi nasana adum pajaro aduga hujiki wari sigi aina summary oina khara haigiba matamda koina healthcare facilities e category ani thokna saigi Aman amadi Ranjan sina layingibu hospital se aman sina government hospital da mahakna layinge aduna government hospital se public health service haigadoini ko aduna aman sina public health service da layinge aduga amuk Ranjan sina private health service tani layingi se maramdi mahakna private hospital da laying banina aduna hojiki wari du aikoina haifet mahaki ngasai wari dugi mahaki summary duma hojik aina nakoida haifet liba matamda akoina kari khangma ngamge haba matamda healthcare facilities e category ani thona lay haba je koina khangma ngame ko aduna kari laige haba matamda public health service haba maga private health service haba maga lay ko healthcare facilities e aduna hana public health services hana koi discussion tawsi. The public health service is a chain of health centers and hospitals run by the government. Aduna public health service haibasi saigi chain ni kari gi health centers amadi hospitals ingi kanana run tawba government run tawba adu government na run tawba adugumba hospitals amadi health center gi chain ni ko saigi public health service haidan harise. And they are linked together so that they cover both rural and urban areas and can also provide treatment to all kinds of problems from common illness to special services. Aduna ngasai health centers amadi hospitals jingse amaga makoi loinamak link tawnei maramdi saigi khungang amadi that means rural amadi urban area mayam jingsidai sida cover tawnanaba haibadi khungang amadi ngasai city area mayam jingsibu cover tawnanaba health centers amadi hospital jingse amaga makoi link lainai and they can also provide treatment to all kinds of problems. That means from common illness to special service. Aduna ngasai lairiba rural amadi urban areas mayam jingse cover tawnanaba amadi ngasai common illness tagi na special service aduna sigumba makalgi treatments mayam amazu piba ngamnanabagidmakta health centers amadi hospitals ngasai government na run tawriba adugumba health centers amadi hospitals jingse makoi amaga loinamak link lainai haibaduni sida harise. And at the village level there are health centers where there is usually a nurse and a village health worker. Aduna village level dadi health center haidana laigani aduna ngasai gi health center sida laigadorisi nurse amaga village health worker amaga na run tawgani habani masigi health center se and they are trained in dealing with common illnesses and work under the supervisions of doctors at the primary health center PHC. Aduna ngasai gi village level da lairiba adugumba health center sida work tawriba nurse amadi village health workers e makoi train tawgadoini kari da makoi train tawgadage haba matamda ngasai gi common illness yamna common oiba adugumba anaba mayam sida deal tawba ngamnanaba makoi train tawgadoini aduga makoi je kanagi makhada kanagi supervision da makoi work tawgadage haba matamda primary health center da laiba adugumba doctor jingsigi supervision makhada makoi work tawgani habani ko. And such a center covers many villages in rural areas. Aduna lairiba siguma center mayam jingsina rural area da lairiba village kayamarum makoina cover tawgani habani ko. And at the district levels is the district hospitals that also supervise all the health centers. Aduna district level dana kari laigadage district hospital aibase laigani ko aduna district hospitals inasu kari yengjangadage haiba matamda khunggangda laiba adugumba saigi health centers kayamarum se makoina amuk yengjangani haibaduni sida hairisi. And large cities have many government hospitals such as the one where Aman was taken and also specialized government hospitals such as the ones in Hakim's story. Aduna achok cities ingdadi saigi Aman amadi saigi specialized government hospital oiriba saigi Hakim Sek wari daga yauriba adugumba achok makalgi government hospitals kayamarum ama laigani haibani city dadi ko. And then come to your next paragraph. The health services is called public for many reasons. Aduna ngasai health services, public health services sida public aidana kaubagi maram yang lai habaduni sida harise in order to fulfill its commitment of providing healthcare to all citizens. The government has established the government has established these hospitals and health centers. Aduna saigi government na makhoi gi commitment fulfill tawnanaba karamba makhalgi commitment no haiba matamda citizens mayam jing sidai sida health care provide tawgani haiba adugumbagi ngasai government gi commitment mayam jing se fulfill tawnanaba gi damakta government jing sina siguma makhalgi hospital amadi health centers kaya maruma makoina establish tawrini haibani sidai sida harisi. And also the resources needed to run these services are obtained from the money that we the public pay to the government as taxes. Aduna siguma makhalgi hospitals, that means public hospitals amadi public health centers siguma mayam jingse run tawnanaba honabada resource kaya marum ama mathau tai. Aduna sigumba resource mayam jingse kadaidagi obtain tawge haiba matamda ngasai public mayam jingchina government the tax haidana thiri base masigi tax sidagi paisa sina adugumba resource mayam jingse obtain tawi haibaduni sigi matek sidai sida haris. Hence, such facilities are meant for everyone. Aduna saigi praja mayam dagi thirakpa tax sina siguma makhalgi resource mayam jingse government na maintain tawbanina siguma makhalgi public facilities ibu they are meant for everyone mayang yoiribane haibaduni ko. And one of the most important aspects of the public health system is that it is meant to provide quality healthcare services either free or at low cost. Aduna yamna maru oiba adugumba aspects of the public health system si karino haiba matamda these healthcare systems is meant to provide quality healthcare services either free or at low cost. Saigi lairiba adugumba healthcare facilities e yamna quality lairiba adugumba healthcare facilities e free natraga yamna low cost ta. That means saigi lairiba mayama manasu layeng ngamnanabagi damakta free natraga low cost ta mayam jing sidai sida adugumba saigi quality healthcare je provide tawhanba haibase sisu. That means mayamda saigi treatment tawba ngamdaba layengba ngamdaba adugumba lairaba miyoi mayam jing sidai sida free natraga low cost ta yamna quality lairaba adugumba healthcare service ama mayam jing sidai sida provide tawhanba haibase masisu government ki yamna important oiba adugumba aspect amani haibani sidai sida haris. And another important functions of public health is to take actions to prevent the spread of disease such as TB, malaria, jaundice and cholera. Aduga amuk public health ki yamna important oiba adugumba function amana karino oiba matamda saigi TB, malaria, jaundice, cholera siguma makhal ki disease mayam jingse sandokpadagi ngakthoknabagi damakta makoina action laukhatpase sisu yamna important oiba function ne habani public healthcare system sigi matek sidai sida harisi. And ngasai disease sidai sida cholera sigi makhada kai disu laige haba matamda diarrhea, chikungunya etc. aduna sigumba disease kaya marum se mayam dagi spread tawbasidagi ngakthoknabagi damakta laukhatliba adugumba action se sisu yamna important oiba functions of the public healthcare system aibuduni sidai sida haris. And this has to be organized by the government with the participations of people, otherwise it is not effective. Aduna saigi lairiba public healthcare system sina paikhatliba adugumba khongthang mayam jingse effective oihange haragadi people participation haibase masisu yamna important oi haibaduni ko haibadi people participation yaudana government khaktangna organize tawbada effective oiroi aduna sigumba makhal makha kayagi. That means saigi public healthcare system sina paikhatliba makoina laukhatliba khongthang mayam jingse effective oihange haragadi ngasaigi government du khaktangna yaroi government sigi mathakta people's participation haibase masisu yamna important oi haibaduni sigi matek sidai sida harisi. So student makha chathadringi mamangda koisigi matiksi mahana discussion tausi why pay taxes to the government. Government da aikoina tax oina thiri base kari maramgi damakta thiri no haibaduni sidai sida harisi haibadi kari maramgi damakta thiri no ꯑꯗꯨꯒꯨꯝꯕ ꯃꯌꯥꯝꯒꯤ ꯀ꯭ꯋꯦꯁꯟꯗꯨꯒꯤ ꯑꯟꯁꯔꯗꯨꯅꯤ ꯁꯤꯗ ꯑꯩꯈꯣꯏꯅ ꯗꯤꯁꯀꯁꯟ ꯇꯧꯗꯣꯏꯁꯤ ꯋꯥꯏ ꯄꯦ ꯇꯦꯛꯁꯦꯁ ꯇꯨ ꯗꯤ ꯒꯚꯔꯟꯃꯦꯟꯗ ꯑꯩꯈꯣꯏꯅ ꯇꯦꯛꯁ ꯑꯣꯏꯅ ꯊꯤꯔꯤꯕꯁꯤ ꯀꯔꯤꯒꯤꯅꯣ ꯍꯥꯏꯕꯗꯨꯅꯤꯀꯣ Government uses tax money for providing many public services for the benefit of all citizens. Aduna government sina tax tagi lakpa adugumba money mayam jingse makoina kari decision nage haiba matamda many public services for the benefit of all citizens. Praja mayam jingsi dai sida kana naba adugumba public service kaya marum amada saigi government jingsin season ai haibaduni ko atuna karamba service to season age haiba matamda defense police judicial systems highways etc benefits all citizens atuna saigi siguma makalgi haibadi citizens mayam jingsidai sida benefit oiraba adugumba service saigi defense police judicial systems highways etc siguma makalgi service mayam jingsidai sida saigi government jingsina tax tagi lakpa adugumba money mayam jingse makoina use tawi haibaduni ko otherwise the citizens cannot organize their service for themselves aduna government na tax tagi lakpa adugumba paisa mayam jingsina sigumba service mayam jingsidai sida sizinaraga makoina sembidragadi citizen mayam jingdadi siguma service makoi masa na organize toba ngamamoi haibaduni sigi matek sidai sida haris and taxes funds developmental programs and services such as education healthcare employment social welfare vocational training etc required for needy citizens aduna needy citizens haibadi ngasagi laireba citizens haibani ko aduna adugumba needy citizens mayam jingsina darkar taba adugumba educations healthcare employment social welfare vocational training etc aduna sigumba makalgi programs amadi service mayam jingse haibadi sigumba makalgi developmental programs amadi service lairiba mayam jingse funding taunanaba honarapadasu taxes tagi lakba adugumba money se use tawi haibaduni and tax money is utilized for relief and rehabilitations in case of natural disasters such as floods, earthquakes, tsunamis, etc. Aduna tax tagi lakpa adugumba money se kari dasu amuk sizinage haiba matamda relief amadi rehabilitation tarakpa matamda for example natural disaster oina koigi floods earthquakes tsunami siguma lakpa matamda relief amadi rehabilitation tarakpa matamda su tax tagi lakpa money sina utilize tawi haibani and space nuclear and missiles programs are also funded from the revenues collected as taxes aduna space nuclear amadi missile program sigumba mayam jingsidasu fund tawrise kadaidagi revenue na fund tawge haiba matamda tax tagi khongkatpa adugumba revenue dagi fund tawi haibaduni sidai sida haris and lastly government provides some services especially for the poor who cannot afford to purchase them from the market adudagidi amu government sina lairaba mayam jingidamakta adugumba saigi lairaba mayam jingsina market tagi leiba ngamoidauba makoina market tagi leibada makoina afford toba ngamoidauba adugumba special service kaya marum amasu government na adugumba lairaba praja jingsidai sida provide tobi haibani ko aduna karamba facilities government na provide toge haiba matamda isam samba example hairagadi healthcare aduna healthcare si example pbi aduna healthcare haibasi healthcare system that means healthcare haibase saigi lairaba praja mayam jingsina makoina market tagi afford toba ngamoidauba adugumba system amani ngasaigi government na praja mayam jingsidai sida provide tobiriba adugumba ngasaigi service sidai sida yauribasiko aduna healthcare nataba atopa service mayam amusu lei aduna adugumba mayamdugi manungda khwaidagi important oiba service hairagadi healthcare service ni aduna saigi praja laireba praja mayam jingsina market tagi makoina afford toba ngamoidauba adugumba service khara government na provide tobi adugi government provide tꯧriba adugumba service sigi example hairagadi healthcare se masi akoina example oina piba yare aduna healthcare nataba atopa example mayam amasu leiko aduna adugumba mayam dudagi important oiba hairagadi healthcare se masi yamna important oire government na adugumba lairaba praja jing sida provide taubiba adugumba service hairagadi aduna leiriba praja mayam jing sina government ta tax haidana thiribase kari maramgidamakta thirino haibase nakhoi loinamak gyan taramani haidana khali. So student, I hope you all understood up to this. Now come to your next page and let us continue our lessons. Now recall the case of Hakim Sheikh. Would you like to know what the court said in that case? Aduna mamangda koina Hakim Sheikh ki story ama pagre aduna ngasai gi story daiduda saigi Hakim Sheikh amadi magi ngasai gi organization duna court ta case tauki haba khatani court ki rai kari tarake haba do koina khangba ngamkhide adugi makha tarakduni hojik sidai sida lakaduisi. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide healthcare facilities to all. Constitution ki matungina ngasai government ki makoi ki primary duty se karino haiba matamda lairiba people mayam jing sigi makoi ki welfare se haibadi lairiba praja mayam jing sigi safana ba tauba amadi healthcare facilities mayamda loinamak piba haibase government amagi primary duty ni karigi according to constitutions. Aduna constitution ki matungina ngasai government ki primary duty se karino haiba matamda lairiba praja mayam jing sidai sida safana ba taubiba amadi healthcare facilities loinamak phanganba sigi se government ki primary duty ni ko. And the government must safeguard the right to life of every persons. Aduna government na lairiba praja khudimaki makoi ki right to life se makoi na safeguard oina thamgadoneba. And the court said that the difficulty that Hakim Sheikh had to face could have cost him his life. Aduna court na kari haige heba matamda saigi Hakim Sheikh ta thengnariba adugumba khudongchadabasina mahaki mapunsi loiramba vau yai haibaduni ko. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. Aduna hospital amatana saigi lairiba miyoi dugi magi saigi treatment se matam chana treatment tawba ngamdragadi saigi lairiba adugumba right to life hairiba masigi lairiba praja khudimakta saigi government na safeguard oina piriba adugumba right to life se masi se satisfy oihandre haibaduni sidai sida hairisi haibadi saigi lairiba hospital mayam jingsina saigi praja amada lairiba adugumba treatment se makhoina timely oina matam chana adugumba treatment se makhoina pidaba haibase karino haiba matamda saigi right to life se makhoina fulfill tawhandre haibaduni sigi matik sidai sida hairisi. Now the court also said that it was the duty of the government to provide the necessary health services including treatment in emergency situation. Aduna court na mo kari haige haiba matamda government ki duty se karino haiba matamda ngasai lairiba adugumba praja jing sidai sida ngasai darkar taba health service provide tauba karamba ngasai treatment in emergency situation yamna emergency oiba adugumba situation sidai sida treatment piba haiba ngasai adugumba necessary healthcare service se government na praja mayam jing sidai sida provide tauba haibase ngasai government ki duty ni haidana court na mo hairami ko. And hospitals and medical staff must fulfill their duty of providing the necessary treatment. Aduna hospital amadi medical staff leiba mayam jing sina makoi gi ngasai gi duty karamba duty no haiba matamda darkar taba treatment necessary treatment provide tauba haibase makoi gi duty ni aduna masigi duty se fulfill tawgadabani haidana court na mo hairami ko. And Hakim Sheikh was denied treatment at various government hospitals. Aduna ngasai Hakim Sheikh se government lairiba government hospitals mayam jing sidai sida treatment tawbadagi denied loinamak tawrami. Aduna the court asks the state government to give him the money that he had spent on his treatment. Aduna court na karida rai tage haba matamda sahi state government sina ꯉꯁꯥꯏꯒꯤ hakim seksina private hospital da layengbada changgiba adugumba magi ngасꯥꯏꯒꯤ treatment tawba mayamjing sida changgiba adugumba paisa mayamjing se state government na hakim sekta pigadabani haidana court na final oina right taki haibaduni sida hairis. With this we have completed, that means we have completed explanations of public health facilities, that means public health sectors or public health services. Now let's focus on private health facilities, that means private health sectors or private health systems. Private health facilities, there is a wide range of private health facilities that exist in our country. Aduna koi country sida private health facilities kaya marum ama laigre. A large numbers of doctors runs their own private clinics. Aduna doctor kaya marum lairiba doctor mayam sina masa gi oijaba private clinics kaya marum run tawrga lay. In the rural areas, one finds registers medical practitioners RMPs. Aduna khungang-dadi aikoina thengnagadoi register medical practitioners RMPs haidana ugani ko aikoina khungang-dadi. Adubu urban areas tadi kedaure. Urban areas have a large numbers of doctors, many of them providing specialized services. Aduna urban dadi doctor kaya marum ama laigre. Aduna lairiba adugumba doctor mayam jingsida kari provide tawge mayamda specialized service. Specialized oiraba adugumba services kaya marum ama adugumba urban da laiba doctors, urban area da laiba large number of doctors mayam jingsina provide tawi ko. There are hospitals and nursing homes that are privately owned. Aduna hospitals amadi nursing homes kaya marum ama laigre. Adusu privately owned, private oina run tawba adugumba makhalgi hospitals amadi nursing home kaya marum ama laigre urban area dadi. And not only that, there are many laboratories that do tests and offer special facilities such as X-ray, ultrasound, etc. Aduna urban area dadi specialized service provide tawba adugumba doctor kaya marum ama laigibada natana hospital, nursing home, privately owned tawba hospital, nursing home kaya marum ama su laigre. Adugi mathakta saigi laboratories test tawnanaba adugumba laboratories amadi ngasai offer special facilities such as X-ray, ultrasound, etc. Sigumbagi facilities mayam ama fangba adugumba kaya marum ama laigre haibani urban area dadi. And there are also shops from where we buy medicines. Aduna aikoina hidak lairiba adugumba shops kaya marum ama su laire haibani hojikti adusu anambana privately owned ngata tawba haibadi private oina run tawba adugumba makhal kaya marum ama laigre haibaduni ko si matek sida hairis. Now come to your next page. As the name suggests, private health facilities are not owned or controlled by the government. Aduna ngasai maming se haibadi ngasai private health facilities haiba maming se kona taba matamda kari khangba ngamge haiba matamda private health facilities haiba sidi mahakti own amadi control amata tawdeba kanana government. That means government na control amadi own tawde haibani ngasai private health facilities iti ko. Aduna ngasai mahakti privately oina run tawi government na run tawde haibaduni sida kona khangma ngamisi. And unlike the public health services, in private facilities, patients have to pay a lot of money for every services that they use. Aduna, unlike public health services ka manadabada private facility dadi kari tawge haiba matamda ngasai layengba laiba adugumba patients mayam jingsina makoina piriba adugumba service makoina sijanariba adugumba service khudingbaki oina paisa mayam ama makoina thiba mathau tarami haibani private facility dadi unlike public health services. Today the presence of private facilities can be seen all around. Duna hojik akoina private facilities kaya marum ama akoina uba fangamani ko. In fact, now there are large companies that run hospitals and some are engaged in manufacturing and selling medicines. Aduna hujik aikoigi akoibada akoina private facilities ngaktani akoina uba fangisi ko. Aduda natana ꯉꯁꯥꯏꯒꯤ ꯂꯥꯔꯖ ꯀꯝꯄꯅꯤ ꯑꯆꯧꯕ ꯂꯩꯔꯤꯕ ꯃꯌꯥꯝꯁꯤꯡꯁꯤꯅ ꯃꯈꯣꯏꯅ ꯔꯟ ꯇꯧꯕ ꯍꯣꯁꯄꯤꯇꯥꯜꯁ ꯀꯌꯥ ꯃꯔꯨꯝ ꯑꯃꯁꯨ ꯑꯃꯨꯛ ꯂꯩꯔꯦ ꯑꯗꯨꯅ ꯀꯝꯄꯅꯤ ꯃꯌꯥꯝꯁꯤꯡꯁꯤꯅ ꯍꯣꯁꯄꯤꯇꯥꯜ ꯔꯟ ꯇꯧꯕꯗ ꯅꯠꯇꯅ ꯀꯝꯄꯅꯤ ꯈꯔ ꯑꯃꯗꯤ ꯉꯁꯥꯏꯒꯤ ꯃꯈꯣꯏꯗꯤ ꯃꯦꯅꯨꯐꯦꯛꯆꯔꯤꯡ ꯑꯦꯟ ꯁꯦꯂꯤꯡ ꯃꯦꯗꯤꯁꯤꯟꯁ ꯍꯤꯗꯥꯛ ꯁꯨꯡꯕ ꯑꯃꯗꯤ ꯍꯤꯗꯥꯛ ꯌꯣꯟꯕꯗ ꯑꯃꯨꯛ ꯃꯈꯣꯏꯅ ꯑꯃꯨꯛ ꯑꯦꯡꯒꯦꯖ ꯇꯧꯔꯒ ꯂꯩꯌꯦꯕ ꯑꯗꯨꯅ ꯑꯗꯨꯒꯨꯝꯕ ꯑꯆꯧꯕ ꯀꯝꯄꯅꯤ ꯃꯌꯥꯝꯁꯤꯡꯁꯤꯅ ꯃꯈꯣꯏꯅ ꯍꯣꯁꯄꯤꯇꯥꯜꯁ ꯀꯌꯥ ꯃꯔꯨꯝ ꯑꯃ ꯃꯈꯣꯏꯅ ꯆꯂꯥꯏꯔꯛꯄ ꯑꯗꯨꯗꯒꯤꯗꯤ ꯈꯔ ꯑꯃꯅ ꯉꯁꯥꯏꯒꯤ ꯍꯤꯗꯥꯛ ꯁꯨꯡꯕ ꯑꯃꯗꯤ ꯍꯤꯗꯥꯛ ꯌꯣꯟꯕꯗ ꯑꯦꯡꯒꯦꯖ ꯇꯧꯕ ꯀꯌꯥ ꯃꯔꯨꯝ ꯑꯃ ꯌꯥꯎꯔꯦ ꯍꯥꯏꯕꯅꯤ ꯁꯤꯗꯩꯁꯤꯗ ꯍꯥꯏꯔꯤꯁꯤ ꯑꯦꯟ ꯃꯦꯗꯤꯀꯦꯜ ꯁꯣꯞꯁ ꯑꯥꯔ ꯐꯥꯎꯟ ꯏꯟ ꯑꯦꯚ꯭ꯔꯤ ꯀꯣꯔꯅꯔ ꯑꯣꯐ ꯗꯤ ꯀꯟꯇ꯭ꯔꯤ ꯑꯗꯨꯅ ꯍꯤꯗꯥꯛ ꯌꯣꯟꯐꯝ ꯁꯣꯞꯁ ꯃꯦꯗꯤꯀꯦꯜ ꯁꯣꯞꯁ ꯀꯌꯥ ꯃꯔꯨꯝ ꯑꯃꯁꯨ ꯍꯧꯖꯤꯛ ꯑꯩꯈꯣꯏꯒꯤ ꯀꯟꯇ꯭ꯔꯤꯁꯤꯒꯤ ꯏꯆ ꯑꯦꯟ ꯑꯦꯚ꯭ꯔꯤ ꯀꯣꯔꯅꯔ ꯈꯨꯗꯤꯡꯃꯛꯇ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨꯒꯨꯝꯕ ꯍꯤꯗꯥꯛ ꯌꯣꯟꯐꯝ ꯃꯦꯗꯤꯀꯦꯜ ꯁꯣꯞꯁ ꯀꯌꯥ ꯃꯔꯨꯝ ꯑꯃꯁꯨ ꯑꯩꯈꯣꯏꯅ ꯎꯕ ꯐꯪꯏ ꯍꯥꯏꯕꯗꯨꯅꯤ ꯁꯤꯒꯤ ꯃꯇꯦꯛ ꯁꯤꯗꯩꯁꯤꯗ ꯍꯥꯏꯔꯤꯁꯤ. So student, with this we have completed explanations of public health systems and private health systems. I hope you all understood what is public health systems and private health systems very clearly. So I hope you all understood up to this.